Welcome everyone. This is the last webinar of our early webinar series with the title The Quality Challenge, Ensuring High Standard of Rural Water Infrastructure from the Outset. My name is Aline Saraiva-Okello. I work with the Secretariat of the Rural Water Supply Network, and it's our great pleasure to host you today in this webinar. This webinar is organized by SCAT Foundation, World Vision, Agenda for Change, University of Surrey, and TIA Fund. We'll have speakers from each of these organizations. Please continue to say hi in the chat box, tell us your name, where you are joining us from. Can we have the next slide, please? A little bit of housekeeping. So this webinar will be recorded, and we'll be sharing the recording and the presentations after the webinar. As you're already doing, continue to introduce yourself in the chat box. You can tell us your name, organization, and where you're joining us from. When you have questions throughout the webinar, please put them on the Q&A box. This is located on the bottom bar of your Zoom. And please feel free to share your comments in the chat box. We will be sharing a short survey at the end of the webinar. Please fill out this survey because it helps us to improve our services for the next webinars. Next slide, please. Today, this webinar, we have interpretation services, so you can hear in English or in French. So please, if you'd like to use this service, you can see the little globe on the bottom of your Zoom bar, and you can select the English or French channel, which are the options that we have today. And next slide, please. So covering the agenda for today, we'll be having welcoming and opening remarks by Bethlehem Mengistu from Agenda for Change. We'll have presentations from Salo Puje from University of Surrey, from Guy Makoni from World Vision, Samuel Diarra from World Vision, and also Adam Questad from World Vision. And we'll have the discussion with Adam and Frank Reeves from TIA Fund. And the Q&A will be moderated by Bethlehem from Agenda for Change. Finally, we'll close the webinar with closing remarks by Sean Furey, the director of RWSN. So without further ado, I would like to pass over to Bethlehem. First, Bethlehem is a long-time global WASH expert with extensive experience in building collaboration, partnerships, and system approaches. She's currently the global coordinator of Agenda for Change. She has over 20 years of experience in the development sector and deep knowledge of African policy, spanning the areas of WASH, gender equality, human rights, and governance. Throughout her career, she has provided technical advice to governments, development partners, and technical teams, and held multiple leadership roles where she advanced programmatic impact and influence in Ethiopia and more widely in East Africa and parts of the Asia region. So without further ado, please, Bethlehem, over to you.
Thank you, Eileen. Good morning, good evening, good afternoon, everyone. Thank you for joining us today. My name is Bethlehem Mengistu. As Eileen mentioned, I'm the global coordinator of Agenda for Change, which is a member-based collaborative platform on WASH system strengthening through collective action. I'm truly pleased to join today's webinar, given the relevance and timeliness of the topic. During the time that we'll be spending together today at this webinar, we'll be exploring the quality challenge and approaches to ensuring a high standard of rural water infrastructure from the outset. We all recognize that poor quality infrastructure continues to be a sustained problem and a challenge in rural water supplies. Therefore, in this webinar, we strive to provide a platform to discuss the issue, including looking at some of the types of quality problems encountered, and also hear from the experiences of several organizations and practitioners who have managed to consistently procure quality components. So lots to look forward to. We have a brilliant lineup of speakers, as Eileen has mentioned to us earlier. and they'll be sharing their experiences on how they've been tackling the quality challenge. But before we bring in our speakers, let's quickly look at where hardware or infrastructure fits in the broader WASH system. Next slide, please. So infrastructure is part of the system, and the system is made up of complex and interconnected components that help the system function. So over time, as we build blocks across the system, as we strengthen the building blocks of the system, we start to see the emergence of a strong and resilient sector. So the diagram that you see in front of you on the slide is essentially conveying the various building blocks within the WASH system. So you have what we refer to the factors on the left side and the actors on the right side. So a WASH system strengthening approach involves taking actions and supporting interventions that are considered likely to strengthen one or more elements or blocks of the whole system. So this includes strengthening both the factors, which are on the left side, as well as the capacity of the actors, which are on the right side, and their interrelationships to improve the quality and sustainability of WASH services. So the key message here is investing in just one aspect of the system or an isolated block in the system, for instance, just the infrastructure, will not address the systemic challenge and will essentially continue to undermine comprehensive sustainable outcomes. Following slide, please. Um, a systems blind approach is one that focuses on just one aspect of the system. For example, increasing coverage rather than striving to ensure sustainable access. So we see this in many places in the various contexts that we're operating in. We see levels of functionality becoming increasingly low over time, and water access being granted only for brief periods due to the fact that the approach may be systems blind. Next slide, please. A systems approach strives to tackle the underlying factors. For example, when we look at finance needed to sustain a water point, a systems lens employs an approach to finance that looks beyond the CapEx, but looks at the MANEX and also looks at the human resources component around capacity to manage and oversee the continued operations of the water point. And this also links to mandates, roles, and responsibilities around different institutions at district and local level, or even national level, depending on where we are operating. And this also further links to regulating a regulated context, a policy environment that looks at supply chain, but also oversees minimum standards for quality inputs into the sector with regards to spare parts and other inputs needed to ensure access to rural water supply. So looking at the actors and factors to ensure provision of sustainable water access beyond the project period by looking at the underlying factors linked to financing, planning, regulation, institutional mandates, but also the roles of the various actors at national, district, and local level are all essential for the systems approach, which is critical to ensure sustainable water access is availed to communities for a long period of time. Next slide, please. Given that the infrastructure is part of the system, as I mentioned earlier, with the different factors and actors interact, it's important to underscore that no single organization can unilaterally effectively address the system's weaknesses or systemic weaknesses. So delivering systemic change requires collective action. It requires multiple people, agencies, organizations working collaboratively together to be able to achieve a common goal or a common objective. With that very brief but broad framing for today's webinar, I will now move to introduce our presenters who will be sharing their experiences on tackling the quality challenge. And we have a fantastic lineup of speakers. As mentioned by Eileen earlier, we have Salou Pouget from University of Surrey, We have a team from World Vision. We have Adam Kestad from World Vision, Samuel Diera from World Vision, and Dr. Fungai Makoni also from World Vision. And I will provide a bit more detail on their profiles as their presentations come up. We'll first start with our first presenter, who's Salou Pouget. Salou Pouget is a chartered civil engineer, currently engaged in a research project titled Assessing Infrastructure Resilience in Small Water Supplies in Balama, Sierra Leone. And Salou will be presenting a case study from Sierra Leone with key insights and also highlighting key experiences around tackling low quality impact on functionality of water supply systems. Salou, over to you.
Hi everyone. My name is Salou Pouget, and I'm a chartered civil engineer and PhD candidate at Surrey University. So for the agenda today, I'll be doing a bit of introduction. For the 9 minutes I'll be discussing why I choose to take this research project and how the research project itself has evolved over time. Why I decided to look at small water supplies. That then takes me into the raising for poor, I'll then discuss on poor quality hand pump components. And I will look at really what to do with some of these components. So I decided to really do some lab work on some of those components. And I will then explain what really the lab work is going to be. And that really will be the end of my presentation. So introduction, why research project? So just before COVID, I was invited by the network for BAM Noto. I was invited to join the team as one of the lead engineers to go to Freetown and help deliver the Freetown Water Rehabilitation Project. The project itself was all about really rehabilitating the water system in Freetown, because the system was underperforming, and it's the main system that is responsible, network that is responsible for providing water for communities within the capital. you know so when I arrived in Freetown, as a lead engineer, I delivered a project. I'm also a native of Sierra Leone. I'm from Sierra Leone. But I was really struck, you know why the system. It was a gravity-based system, but why half of the country, or half of the population of the city, sorry, were not able to get clean drinking water. I needed to understand that. And then when I then returned to UK, I decided I wanted to do a research. My research initially was just focused on the water system in Freetown. So I applied to do research at Surrey University, and I was given a place and a supervisor. Why small water supplies? As I initially said, when I came back on my research project, I wanted to focus just on the Freetown water supply system. In a discussion with my supervisor, she recommended I go out and read some of the publications done by Kirsten Dunner, Donald John, and Emily. It was very interesting. So when I went, I searched for these articles, and luckily for me, was really Stop the Rot. First I read, and then I went to Stop the Rot too. It was so interesting. I was just so intrigued, and then I realized I'm really, really interested in this. I then read another publication by Donald John, looking at the contribution of physical factors to hand pump borehole functionality in Africa. But I kept coming back to Stop the Rot, the report. I've just found corrosion. I've just found the quality of the materials, the quality of the component, and that then just resonated with when I was working in Freetown. The component, the leakages, the water system. Why the system couldn't really supply the community. And that really just brought me back. It resonated so much with me, and I just decided I'm going to look at smart water supply system. But before, I wanted to take a field trip to understand, to really know whether what these rural communities, what I've read, is it what is really reflected? Is this what is happening in the communities? And so I did embark on my first preliminary field trip, and I'll talk about that as we move along. In Sierra Leone, I liaised with Interaid in Sierra Leone. I coordinated with Interaid. I met them in the office, and luckily for me, they took me on a field trip. And I was also able to speak to their local pump technicians, community members. So in Sierra Leone, on my preliminary field trip, I went on board with Interaid, and we went to the very, very rural community. That was really when I really started understanding the problem of poor quality hand pump component. You know, I could understand from the suppliers. I mean, when I spoke to the local pump technicians, and they told me that they believe, from what they have seen, from their experience, a poor quality hand pump component was probably one of the reasons for the non-functionality of the hand pump. I couldn't really understand. Definitely, I know in Sierra Leone there were quality stuff, and there were those that were less of a quality or poor quality stuff. But the level at which they they discussed with me, with the evidence I saw, as you can see, you can see some of the components. You can see that, you can see some of the components, and I was then able to see the riser pipes, some of these stuffs, that they're put in the corner. They say, well, these are really components sometimes that are meant to last for a couple of years, but they take a couple of months, a few weeks, And so for me, that really kind of just resonates to what I have read in Stop the Rot 1, 2, and 3. And I was really quite keen to learn more, But also another issue that I experienced in Sierra Leone was they told me about the system there. They told me about what they experienced with regards to um, coping mechanism with seasonality. I really wanted to understand that, and I will do research. I will talk about that at a later date. So I decided to do the lab test. I wanted to look at the effect of corrosions on hand pump, as it was much clearer to me now. It's a problem that have been known for 3 decades and it's still there. So which component can I test? Which of those components was I going to take to the lab? I then went back to Interaid and said, listen, give me something to plan with. Give me some of your report on some of the components you have replaced, you think has been responsible for the past 3 years. And they give me a list of some of the diagnostics form for some of the components that they replaced. And I then put that together. So as you can see, I had um, they gave up to a report for up to 23 hand pumps, as you can see. And if you look at this, those that went really above 10, above uh, uh, 10 years, which was only 22% of those that were above 10 years, and then I then came here, and 30% of those, were below 5 years. And this was the bit that was really worries me. 35%, 30% was below 5 years. And some of these, they were just 2 years. And there was one, I think, those couple I looked at, they were just, I believe they were 18 months or so, and then definitely on the good side, there were those that went from 5 to 10 years. It was up to 48%, which I think again, it's not a bad. They were between 5 to 10 years, but really it's just 22% that went above 10 years, But that was just one set of the information I got from Interaid. I then decided really to go to the water point, to speak to those people that really get the water, to speak to pump technicians, hand pump technicians, to speak to water point committee members, to also speak to local experts, to other NGOs that were involved in it, And as you can see, these are some of the parts that they said has been replaced quite often. You see the riser main, 23%, 23%. I spoke to up to 540 people, and out of the 540 people, 23% of those says the riser mains, and the next one is the pump rod. Then other looks at the 14%, as you can see, for the seals, for the pumping handle, and others. But really look at these two, 23% and 2%. It then came out clearly, that the riser main and the pump rod, those are components that are often being replaced. And these are some of the components that are meant to last around 8 to 10 years. So I have really decided to focus on this component. These are some of the components I'll be testing in the lab. And I'm very excited that some of this testing I will share with you in the next Stop the Rod meeting webinar. So what I then did, I then bought those components. I said, well, I needed this component. I went there. As you can see, if you can see here, you can see the thicknesses here. You can see the thicknesses in this compared to this, and you can then see the GI pipe, the steel pipe, Definitely part of my research is to bring some of this component back to the lab, to really test them, The idea behind the test is really to try and see some of these components, how fast can they go, can they become rot, how fast can they deteriorate, so I really needed to understand that, and I'll be doing lot of lab works, testing this component to really see how fast they become corroded, but you can just see, you can see the differences in the thickness between this component and that component, and then you can then understand, you know uh, the quality, you know, but again, this is something I have to try in a lab for me to have a forensic evidence to support this. I cannot just look at this and say, well, this will serve better than this. I have to look at the other conditions under which they are both applied. So lab testing, how am I going to do lab testing? So definitely I'm going to get a hand pump component testing. I'm going to look at one side on the standard component, and I'm going to look at the poor quality component, and I'm going to do both mechanical and chemical tests. And chemical tests, really, I'm talking about, really doing the lab, doing the testing for the lab is really for corrosion. I'm really definitely going to focus on corrosion. I want to look at the lab conditions and see whether I can then also look at the environmental conditions, So I'm going to get the standard component and this, what I will consider the poor quality standard component, and do comparison also. And I'm going to also go define what standard component is to what a poor quality component is. So I'm also going to be able to define that clearly before I go to the lab. But I am keen on really trying to do this for me to be able to really kind of like understand how fast can this go corroded. What it's telling me on the ground, does it really support what I'm seeing in the lab? And I'm very excited. Really, I'll be coming back to this forum, to share my findings with you, to tell you what are some of these results, whether they line up to what I have been told, or whether some of these things I've read. And I'm very sure it'll be an exciting findings for me to share with you, and I look forward to that. So why am I really doing this? I keep asking myself, why again? But again, I have to look at it. 1 in 5 in sub-Saharan Africa, 200 million rely on hand pump as the main source. Yeah. And then again, component that may last 8 to 10 years require replacement after a few months, a couple of months. And again, I'm really focusing on corrosion. I want to see that the problem here, really, I'm focusing on corrosion. I want to see 3 decades, and minor mistakes are still being repeated, So definitely what I'm going to be doing, I'm going to be analyzing this data I collected from Sierra Leone. Of course, some of these data I've analyzed, as you can see in the graph, which of those components, the water users, I spoke to nearly 500 people, which of those components they say were responsible, for those non-functionality of the hand pumps. I'm also going to really, again, I'm planning to start my lab test in September, and hopefully in our next session at Stop the Rot, I really should be able really to bring some of these findings to you, and I look forward to the questions and the excitement we can all have on what some of these findings will be. Thank you for listening.
Thank you, Salu, for your presentation and sharing with us how low quality components impact functionality of water supply systems, with a particular emphasis on corrosion and coping mechanisms for communities affected by various unpredictable seasonal variations. It's really interesting how some of the issues raised also linked to broader external factors, linked to quality control regulation, the role of the state, and minimum standards. So hang on to your questions. We're seeing some questions coming in the Q&A, and we will be getting to those right after we hear from our next set of presenters. So our next set of presenters will be from World Vision, and the team from World Vision is going to be sharing their organizational journey to creating a culture of quality supported by various case studies across their operational spaces or country programs. So we have three presenters from World Vision. Next slide, please.
Good morning, good afternoon, good evening from wherever you're joining us today. We are so grateful that you are here, and we're eager to share about World Vision's journey towards building a culture of quality. We believe that doing so will result in progressively improved WASH services that are safe, accessible to all people, functional, equitably delivered, and reliable, especially during climatic shocks. So how are we approaching our journey towards building this culture of quality? Let's dive in to find out. Today I'm joined by my colleagues Samuel Diarra and Dr. Fungi Makoni, who will be mostly leading this presentation. And they have a wealth of experience, as you can see in their biography and may have already heard. And I am just so grateful to be working with them and look forward to answering your questions at the end of this presentation.
The agenda we are suggesting will be like this: World Vision Quality Journey, why a culture of quality, and spotlight on material standard and procurement. We are coming from far. Actually, we started with the Ghana Water Project, where the quality was assured by the baseline, midterm, and endline evaluation. We did the same with West Africa Water Initiative. And then we introduced the concept of internal audit with the government feedback, community involvement, water quality, ownership, and sustainability. And then in 2017, with the UNC 14 country evaluation, we came to identify several gaps and even water quality issues that actually took us to a new initiative, and those initiatives include the peer review program, the innovation committee, and the consultant review, all this to ensure the quality. From the UNC 14 country evaluation, we realized that World Vision was doing better than control zone in many aspects, pending that we have ensured the basic water and basic sanitation services better than the comparison zone, but also we suggested improvement, including the safely managed water service, hygiene and hand washing, source water quality, healthcare facility sanitation. This 14 country evaluation also revealed that we have trace metals, mostly lead, with great exceedance, exceeding the WHO guideline value and even the national standards. Based on that, we decided actually to respond. In our response, we included the internal procurement guideline and for suppliers, the procurement guideline for procuring certified material in one document, and we replicate the same document for staff and for suppliers. And then we revised our water quality protocol to align with the finding of the 14 country evaluation in order to have quality water. In additional, we did regional training for our staff to reinforce those guidance, but also to ensure that the staff is understanding the aspect of quality.
Thank you, Sam, for the overview of our journey so far and the incredible accomplishments that have been made. As We at World Vision continued to look for ways to improve quality. We also looked at the literature around quality. And it became clear that compliance, requirements, guidelines, and best practices would simply not be enough, although we recognize that they are very important and helpful. But to actually make changes in quality requires fostering a culture of quality, a cultural shift and change in all that we do. So here's a quick example. If we were building a bathroom, a restroom, a latrine, and we said, provide disability accessible stalls, you might look at this photo and say, well, a stall for a person with a disability has been provided, so it passes. However, if our goal was to truly provide quality services to the users of this bathroom, if we take a step back, we realize that actually we've failed. A user with a mobility impairment would be unable to actually access that stall. And so this requires changing our decisions and our mindsets around around quality and what that actually means. So to begin shifting our culture, we've simply started talking about it and making it a priority in all of our decisions and our discussions, starting with leadership all the way down, because it involves everyone. We're also rolling out incentives for quality, and we're working on ways to share our learnings and spotlight our team's contributions to quality. Our hope is that doing so will create empowered staff to make these quality-minded decisions, quality-focused decisions, instead of just checking boxes and moving forward without thinking about how are we truly meeting the needs of the communities that we serve. As I mentioned, we're starting by talking about what quality really means, and this requires changing our messaging and changing some deeply embedded beliefs at World Vision and in the sector in general. So some typical messaging is shown on the screen, and what we're trying to do is shift what we're seeing. So high quality, quick delivery, low cost. Well, actually, that's not possible if you really truly want quality services. So what we're saying is that we really need time and resources to provide true quality. While we value our donors' budget and schedule requests, and we always try to meet those as much as we can, our commitment is truly to the community, making sure that we're seeing the community as the user of the system, the owner of the system, and how can we make sure their needs are being met, not just for today, but for the long term. And that commitment takes priority over budget, over schedule. And we need to start changing that message that more budget may be required, more schedule extensions may be needed if we're going to provide true quality services. Just stick to guidelines and checklists. That's not going to cut it anymore. As we've seen, we need to be thinking with empathy. We need to walk in someone else's shoes and think about how they will be accessing this community, this service. And then finally, this is just for World Vision. This is just for internal staff. And that is not true, right? We need to be communicating this message all the way up to our partners, our governments, our donors, so that they're clear that we are committed to quality services to the communities we serve, even if that means pushing back on schedules, on budgets, on other requirements, right? We're not going to compromise that quality, and we need to start by changing the messaging and changing our priority, which is what we're trying to do at World Vision.
Thank you, Adam and Samuel, for taking us through the journey World Vision has embarked, particularly on initiating the culture of quality within our WASH programming. I would like to emphasize World Vision's commitment to quality as exemplified by our proactive approach, which have led us to build this initiative and the journey that my colleagues have shared with you. I will be sharing a few examples from our field operations, and particularly from Ethiopia, Zambia, Ghana, and Malawi. In Zambia, as you see in your slide in front of you, we have seen a significant shift towards maintaining quality through the transition from traditional galvanized materials to stainless steel rods and pipes. This is exemplifying a commitment to durability and reliability, and particularly to combat and address the issue of corrosion, as you can see in the slide. Similarly, in Ghana, a notable enhancement in product quality was witnessed as brass steps were replaced with stainless steel steps, reflecting our conscious effort to improve standards and longevity and address the issue of trace metals. In Malawi, we see a country dedicated in upholding quality through its strict adherence to standards and certifications, demonstrating a proactive approach towards ensuring excellency, particularly from the planning stage to the implementation, procurement, and handover process. They have demonstrated that establishing quality specifications during planning and contracting is a crucial step that enhances the quality aspect of our work. Having said this, a few examples that you've seen, and despite all this advancement that as an organization we are doing, we still face challenges, particularly in the lack of robust enforcement mechanisms and legislation for quality assurance. And this has seriously hindered the consistent delivery of high quality products and services in our areas of operations. Moreover, we've also been faced with limited availability of reliable suppliers, contractors, and in particular in fragile contexts, which really poses a significant obstacle to maintaining consistent quality standards across our various, in programs, and hence the need to really underscore the need for sustainable solution and partnership, particularly as we continually address the issue around quality in our programming. And I hope what we have shared with you in this webinar today is also inspiring, and we are learning, and we are also learning from us, and we'll continue making those bold steps towards ensuring that we build the culture of quality in our programs as World Vision, and also inspire other organizations to follow suit, so that we address the issues around quality and stop the rot. I hope we have learned something from this, and I want to thank you for your attention and for listening. Thank you.
Thank you, Samuel and Dr. Makoni, for providing an overview of World Vision's journey towards building a culture of quality, including a summary of where we've come from and where we're headed. We do acknowledge that there are many challenges, as Dr. Fungai referenced, and we look forward to collaborating and being part of your journeys as well. So please feel free to reach out. We're always looking for feedback, ideas, and opportunities to collaborate together. Thank you all.
Thank you. Thank you, Team World Vision, for that wonderful presentation. It was really enlightening, and it's really useful to learn from the internal journey organizations have made. And just to highlight a few things so we don't forget as we move on to hear the reflections from our discussants. There are key milestones that were shared by the team. The internal journey that they went on was shaped by an internal review process and introspect, which informed the development of new guidelines and new policies. And that was preceded by a shift in organizational culture and practice, as well as behavior, so that quality became, or they strive to make quality as a way of working, rather than kind of, as Adam said, like a tick boxing exercise. So the key shifts included prioritizing equity, serving communities, being led by the needs of the community, and enabling empowered partnerships. So there's a question in here, World Vision being as big as it is, what were some of the challenges in bringing about that behavior shift or the mindset shift? Because usually influencing from within an organization is harder than influencing external factors. within kind of the broader enabling environment. So it'll be really interesting to hear the team's reflection on that as we move on to the Q&A at a later point. And at the technical and operational level, the construction inputs that they mentioned were changed along with the procurement specs were really interesting to hear because they link to the ambition of that links to the external challenges, realizing the ambition around shifting towards quality at the input level is challenged by external environment linked to the local supply chain, the policy environment, the regulatory environment, and also the sector's capacity at national district level, all of which links to the kind of the systemic challenges that are at play here. Beyond just the infrastructure. So a lot of interesting points and insights. Thank you, World Vision team, for sharing your internal journey with such level of honesty. Thank you for that. We will now move to hear reflections from our discussants. Our first discussant is Frank, and Frank is from Tier Fund. He has a WASH experience spanning several decades and also has worked with UK water authorities. He began working with Tier Fund around 1990, spending 10 years overseas on long-term WASH programs in Honduras, Tanzania, and Turkmenistan. And Frank has worked as the WASH lead for Tier Fund based in the UK with frequent travel overseas. And he's passionate to see evidence success in sustainable access to WASH, particularly in bridging the humanitarian development nexus, which is very critical. And amongst his favorite WASH approaches includes the training that he provides for Tier Funds, country programs, and partners on water safety planning, demand-led sanitation processes, sustainable rural water management structures, and the role of faith-based organizations in WASH. And thank you, Frank, for joining us today. And over to you.
Great. Thank you very much, Bethlehem. And thank you, team Salu and the team from World Vision. Is great learning and obviously important learning to come in the future. Now, I do have a question, a specific question, but I would like to dwell a moment on the wider issue of quality in WASH, if I may, picking up particularly on the cultural shift to a culture of quality, which is sort of, I think, has caught our emotion, hasn't it? I totally agree with you that this is a necessary mindset shift, but I'm convinced that achievement of quality in our WASH work involves looking at the entire project cycle, not just around the quality of materials or procurement processes or standards. Now, I know that you allude to that too, ultimately, World Vision team, because you highlight the quality of WASH services involving time, resources, even empathy and understanding of community needs. But perhaps we face a common challenge in this cultural shift to quality. At Tier Fund, we're promoting a WASH quality assurance framework, which fundamentally aims to ensure expertise is applied to all stages of the WASH project cycle, and hopefully embracing those attributes you talk about, Adam, at the end there. Sean, if you could put up our slide, please, that would be great. Thank you. Yeah, thank you very much. This diagram shows our interpretation of the project cycle for both what we call infrastructure-based project, such as water supply schemes, they're on the top in blue, and behavioral change or facilitated projects, such as CLTS or hand washing approaches, etc. That's on the bottom. Now, one significant challenge to our shift to a culture of quality is the stage. It's the fourth one along on the top to the right, commissioning. Commissioning. We don't hear about it enough, I think. Usually we talk about implementation followed by handover. And it was said in the presentation, that's the usual model. And we think that this has become a fundamental gap in achieving quality outputs and outcomes in WASH projects. Now, commissioning, in my mind, focuses on the new or rehabilitated wash service itself, its functionality, its robustness, sustainability, safety, that's personal as well as environmental. So, for example, prior to handover, spending perhaps a month closely monitoring water quality, water recovery in the well, the access of users, the community O&M mechanisms, and backstopping and referral protocols. It all takes time, and that there's a cost to time as well as perhaps a financial cost. Handover, we see, is about the readiness and confidence of the user community to take on the new service. So, and our WASH framework here stipulates having to approve each stage before being able to move on to the next stage. Now, that certainly resonates with what you said, Adam, about needing to take time, isn't it? So I don't know then if you guys concur with this view and that we must flag the importance of commissioning. It's just left out. And it can sort of lapse into handover when the problem or the project is no longer ours and the ownership is in questions. So that's my first sort of discussion feed in, is there, what do people think about, do we leave out the commissioning phase? And then just to finish up, my other question is more of an open one. It was mentioned that the idea of rolling out incentives for quality, this was mentioned. Could you elaborate, what do you mean exactly and practically about rolling out incentives? Do we need incentives when we're really pushing quality? What does this look like practically? So two discussion starters there, I hope. Thank you very much. Thank you.
Thank you, Frank. Adam, there are a few questions raised by Frank. Let's hear your thoughts before we proceed to Q&A. So Adam, thoughts, reactions, further insights. Over to you.
Yeah, excuse me. Thank you, Frank. A very, very thought-provoking, insightful questions. And I agree exactly with looking at that entire approach, and from planning through commissioning through monitoring as well. And we certainly do consider the commissioning phase. I'm actually going to turn it over to Sam very briefly to give his thoughts on that one. I did want to say on the incentives, it's something that we're working on, is more of an internal program, but it doesn't need to be that way. But we're trying to show our organization that we really truly prioritize quality. And really, the main goal here is not to, for lack of a better word, gamify this quality problem, but we really want to encourage the gathering of stories and quantifying the benefit and the challenges of quality, which in a very large organization can be challenging to do. And we've made progress there, but we felt like if we're offering incentivization, whether that's through offering quality improvement funds or team dinners, team lunches, and celebrating quality, it really excites people and helps us gather that information so we can continue that cross-sharing between countries, between different teams within World Vision. But I feel like I've talked enough on my presentation. I wanted to let Sam offer some thoughts, maybe on the commissioning question from Frank, and any other quick thoughts you have. So take it away, Sam.
Thank you very much, Adam. And Frank, thank you very much for raising this issue. World Vision is actually seeing the quality issues as the whole process, starting from the planning till the monitoring and evaluation. So we are not excluding any component. The whole cycle is involved. That's the reason why we are saying we want actually to develop a culture of quality. In everything we do, we bring first quality. How can I improve quality in it? And that's the process we are doing. We are developing actually a culture of quality strategy that include all the steps of our intervention. And by the way, let me say that we are not limiting ourselves to what we are doing in World Vision. We are looking also how we can bring government, communities, suppliers, other stakeholders to align with what we are doing so that we can have a broader impact of improving the quality and sustainability of the facilities we are having in the field. That's what I can add on that point. Thank you.
Thank you, Samuel.
Thank you. Thank you. I think, Sam, you've nicely segued into addressing some of the questions that are also being raised within the Q&A. There are a number of questions that are raised for all of you, for all the speakers, asking for further detail and elaboration on each of the presentations. I think we should be able to move directly into the Q&A. The first set of questions, I think we can start with Salu. Salu, there are a set of questions that were directed towards your presentation, linked to water quality and how that can influence hand pump corrosion and its circuits. Any thoughts on that? Can we take an account while evaluating the influence of water quality in producing corrosion? That's a question from Hinet. If we can get your reflections on that. And I think that also links to Gazahian's question, which is also for you around poor quality products, adopting specification of good quality materials. I think that applies to both you and World Vision's presentation as well.
Yeah, I mean, the issue with quality of water definitely has a great influence on, so when it comes to corrosion. For example, if we go to construct a borehole in an area where the pH of the water is below 6.5, definitely the component in there will corrode at a faster rate. Anything below 6.5, really, we're looking at really corrosion. It will accelerate corrosion. And again, my lab test is really looking at those components. When I go to the lab, I would do the quality of the water, the pH of the water at different levels to actually see, you know, whether if we go more to 3.5, 3, how faster can those components really get corroded? You know, so definitely yes, Pian, you have a great point there. We need to really be doing ground investigation before actually do the construction works to know the quality, at least the pH of the water there, whether it's an aggressive groundwater system there, so that if in itself really does affect the component of the hand pump. So I agree with him 100%. We have to be looking at that. I think there was another question as well that says whether we're just looking at the component. No, I mean, within construction, we've got the pre-construction, we've got the construction phase, and then we've got the post-construction. So it's a combination of everything. You know, we have to look at what did they do on the pre-construction, what happened in the post-construction, what happened during the construction, because all of those factors, if it is not being done properly, it does affect the functionality of the hand pump. So it's not just really the quality, but I'm specifically looking at the quality with particular focus on corrosion, really seeing how that pH of water, the pH of a particular section affects the component.
Great, thank you, Salu. And questions for the World Vision team. There are several questions. There's a direct question to Dr. McConey from Kristen, and the question is, it would be really interesting to learn more about your efforts in improving national testing capacity. So reactions on national testing capacity to Dr. McConey.
Yes, thank you very much, Bethlehem. Yes, we have been talking about our journey towards, creating this culture of quality. And one of the things that we have been actually, particularly from the procurement standpoint of view, from the issue specifications and making sure that they are actually outlined in the RFPs And then one of the things that we are working with, in particular when we talk about procurement, is the issue of testing materials. And we have been looking at what you call, we are developing a process, what you call wash category management, where we also work with partners, because sometimes we might not have that capacity in-house, but we are also looking at how can we collaborate with the partners like the universities, like industries that do have equipment like the RFX, which we can use to test some of the materials. So we are building this kind of systems where we want to partner. So it's still a process where we are going in to make sure that whatever we receive, we need to ensure that the quality is per the specifications and the qualities that we have actually prescribed, particularly when you send out to contractors, when you send out to suppliers. So it is a process that we are ongoing when we are still learning from it, but we are saying Malawi, most of our countries are also into that space now. Tanzania is also there, Uganda is also coming in there, where make sure that whatever is delivered, there is a test. Because we are now moving, because every stage, there should be that lens of quality culture and checking on the materials that we are receiving. So if it is in-house or outside, we have to work with partners that can do that. I hope I've answered that. Yeah.
Thank you, Doctor. We have a question on O&M. There's a question for both Frank and also other speakers. A question from Jean is, what do you do about maintenance and upkeep to ensure lasting quality? And also a related question to Frank, at what point in the project cycle do you include operations and maintenance? So if we can have reflections on O&M from the World Vision team and also Frank.
Okay, should I come?
Oh, sorry, go ahead.
Yeah, I believe that the operation and maintenance is one of the most important part when we talk about sustainability. And also, we want also to assure that pump spare parts that are available in countries are also meeting the standard we are looking for. Because whatever we do when we are installing a system, if we have high quality and then for the operation and maintenance, those high quality parts are replaced with poor quality, then we come back to the initial issue, particularly when we are talking about lead occurrence in drinking water. The second component is in our process of the culture of quality, we are working as well with the pump artisan, suppliers, to ensure that they all understand they come with us in the process to bring the quality. And we know there is a cost involvement, there is a time involvement. We agree on that and we process such a way that the quality is assured throughout the operation and maintenance as well. Thank you.
Thank you. Frank, would you like to share your thoughts on O&M and the project cycle?
Yeah, okay, thank you. And thank you, Brian. I was typing an answer there and I was then asked. So, yeah, a very good point. From our project cycle, it's more that we inherently are thinking of O&M in that stage, which we call post-project monitoring. It's continuous monitoring of the impact of what's been going on and how the project is being made sustainable, but also feeding in particular then approaches which improve sustainability post monitoring. So you know, Brian, that one of my favorite approaches is that community-wide ability to maintain water quality, the water safety plan, where everybody has a chance to chip in and maintain the benefits of the new water quality system. So establishing a safety plan within the community. Also, of late, the whole issue around professionalization of services and enabling the financial side of O&M to be kept up. And our latest venture into that is to do with village level saving schemes in South Sudan, where we actually try and get the pump maintenance protocol as part of the VSLA. So it inherently invests in the community and has a financial backing. So yeah, O&M, it's great. It's a very good point. Let's make it more explicit, but we haven't forgotten it. It's in that post-project monitoring and the ongoing sustainability measures we apply. Thank you, Brian. Thank you, Bethlehem.
Thank you both for your reactions. There are a few more questions. There is an important question from John Collette around sanitation and hygiene. Given the fact that our focus has been on water supply, the question is, what are we doing to tackle some of the other challenges in sanitation and hygiene components of WASH? Are there any breakthroughs with behavior change yet? So this is a broader question, which also links to kind of the cultural embedding of quality within programming approaches. So that'll be interesting to look at. Another important question from Bezawit is around rehabilitation. What is the theme's thoughts with regards to sustaining existing systems, given the fact that that's a crucial step to tackle the challenges in rural water supply? So what are some of the efforts that are being taken to rehabilitate and ensure sustainability of investments so far, rather than future investments? So a bit of kind of a question around, how are we taking care of investments we've already made by taking on the new approaches that we've embarked on. So if the team can react to those questions, sanitation and hygiene and previous investments.
Yeah, let me share some thoughts on sanitation and hygiene as well. In World Vision, we started since long time ago, as I presented it in 1985. We started issues of water, sanitation, and hygiene together. We have done a lot of improvement in the way, but we are not yet at that level where we can say, okay, we have checked the material involved in sanitation. We are still working on those aspects to ensure that we have quality material involved, capacity of emptying the latrine facilities, and also even the reuse of the facility once it is emptied at the community level. We are also looking for the more sustainable material that can be used to build those sanitation facilities. Our effort so far is on water systems, but later on we will address the issue of sanitation system in a more comprehensive manner to ensure that they are also in line. Now, the second question is about rehabilitation. Rehabilitation is a low-hanging fruit. Simple. Instead of drilling a new well, you just go and rehabilitate existing well. But there are several issues that need to be addressed if we want to rehabilitate. As one of the questions was about the quality of water affecting the corrosion of the material. So rehabilitating after flushing, after ensuring that the well itself can be sustainable, we have to check the water quality. Not only pH, but we check temperature, because it is one of the factors. But there are some other corrosive material like grain, sand grain, small pieces of chemicals that can also affect the quality of our supply system. So after checking all this, we have to ensure that all the material we are replacing are of high quality, not repeating what have been done at the beginning if they are not of good quality. So we embark in the rehabilitation with the same system of building new facilities, ensuring that we have right material, right equipment, we have the know-how to install them. So that's what I can say so far. Thank you.
Thank you. Thank you. That's really useful. And while I have you, there are a few questions linked to supply chain. The question from Lucas on affordability and quality, looking at how do we integrate quality as a strategic choice while also being able to afford to make choices on quality, given the fact that what may be cheap may not be of quality, but what may be cheap could be expensive in the long term because it requires frequent replacement. So your thoughts on balancing quality and affordability and embedding that choice at a strategic level within World Vision's programming approach, and also the options of utilizing plastic pipes versus steel rods in some locations. So if you could quickly react to those.
I'll react to the first question, and then maybe Sam, if you want to talk about the plastic versus steel. But Lucas, it's a great question, and I think what's really important is that we gather the data and gather the evidence to make strategic solutions and decisions. So we mentioned our partnership with the University of North Carolina Water Institute. And through some ongoing research, which we'll be continuing to share as more data are available, we have realized that low quality brass taps have the potential to leach lead at very high levels. And so while it does feel like an insignificant component, and we're still trying to gather the evidence to see how impactful that one component is, it's still very important. And we need to understand the science behind it before we can say we don't have to worry about that component. The other thing I'll add is we did with our supply chain team, we did an assessment of stainless steel taps versus brass taps. In many regions, the cost was almost the same, depending on the quantity you purchase. So sometimes it's a little more expensive, sometimes it was the same, sometimes it was actually cheaper depending on the suppliers available. So while you would assume that stainless steel is more expensive, it's not always the case. And if we do see lead leaching at the levels that we've seen in the lab, then you're actually putting that external cost on the communities. And so I agree with you, affordability is crucial here. But we also have to consider the evidence and the data that we have to make those decisions. Sam, do you want to offer any thoughts or fungi on the plastic versus steel rods?
Yeah, thank you. So far, we are seeing that there are a lot of improvement in the type of plastic material that are actually available on the market. For example, the HDPE pipes have been proved to be very sustainable as well as stainless steel pipe. But it is not given to every country a possibility to have good quality of HDPE pipe. So in summary, PVC pipe can be also sustainable. They can be also of quality. What talking about the impact on lead, for example, in water, they can be safe, but all about standardization. If they are certified lead-free and they are respecting all the context, for example, the thickness, some PVC characteristic showing clearly that they are more sustainable when we use them. But for some elements like the tap, we moved to stainless steel type of tap in World Vision because they are more sustainable. One, second, they are not leaking any material into water and is the safer way for us to go for the quality. Thank you.
Thank you. Thank you, Sam. There are a few questions on stakeholder engagement, and we haven't had any reactions on that so far. So this is both for the World Vision team and also Frank. There is a question from Abdi Nasir from NCA Somalia, and his question is, in regards to the commissioning of WASH infrastructure, what are the key priorities needed to take into account the role of stakeholders and the role they play, including in the contracting, along with the role of the community? And the other question on stakeholder engagement is from Zahir. Can any of the presenters state the level of engagement of local communities in the planning, design, and O&M stages of implementation? So over to you, Frank. Should we start with you, and then we can hear from the World Vision team?
Yeah, okay, thank you. And thanks for the question. So, yeah, so some of the typical things that involve deep stakeholder engagement as part of commissioning. It would be, so for example, making sure that the resource that's just been created or rehabilitated, that supply meets demand, yeah? That we've got that calculation right. That seasonally, well, commission can't last the whole year, but generally, it suffices for the needs of the community, and and that involves water use as well. It's an integrated resource management question, isn't it? That what's the water being used for? So that sort of that layout of understanding of what people are using the water for, and is there sufficient? And I think monitoring that water quality as well is, I think, is really important. So just making sure that even over some weeks, that water quality is maintained. It's not just the pre-building or the design water quality. It's actually making sure that the finished product is not itself producing a contaminant, and the water quality is being maintained. But then I would say as well, water safety planning, bring that in, getting the community involved, because where does most contamination occur? In the home. So getting people to appreciate and understand what that project brings. Now, that can't just be done in commissioning, and I'm not saying that, but it's something that we identify that can take place afterwards, and people allude to that. So they're just two particular things. Thank you, Bethlehem.
Thank you, Frank. Great response. And the World Vision team, reactions on stakeholder engagement.
Yeah, let me just jump in there. Probably my colleagues also add in, just to pick up on what Frank has already alluded to. That I think the process is, in terms of how we are structured. Let me just give an example for World Vision, the way we do our community engagement. For us, we stay in a community for 10, 15 years. So the initial process before anything is being done is to engage all the stakeholders. Or Frank is alluded to that. We talk about the project life cycle, but I think we are now, because before that, we were just going in with the already designed project, but now we are talking about the life cycle costing of a project. From the inception, from the planning, and outlining, the issues around roles and responsibility, that helps. And even it comes to commissioning, when it comes to commissioning, who's supposed to do what? So I think that process of taking the communities from the beginning, that's why we're also now talking about the culture of quality, not only particularly for water infrastructure. We are also looking particularly, as you are launching also a sanitation hygiene strategy. How can we also monitor the quality of SPC activities? These are the things that we're asking ourselves in terms of how do we maintain quality of all the approaches that we do. So like what I just want to add on that this basically the whole DPA process that World Vision has created, our engagement at the starting level, the assessment, the vulnerability assessment, and who to include from that process and going on forward really helps us to really ensure that at the commissioning time, the issue around life cycle costing, who takes what responsibility is critical. But of course, we acknowledge that there are challenges in terms of operation maintenance afterwards, because at the planning stages, people will agree, but the implementation is another thing, which you will need to see as we continue on empowering, capacitating either the stakeholders doing the private partnership approaches that we are looking at, as we are looking at talking about what you call raw water sanitation, raw supply sanitation programs, or we call them the raw utility programs, based, moving away from what you call the CBM approach, but can we involve the private sector at some point
to ensure that the sustainability and operation maintenance in going forward. So these are the approaches that somewhere we are using in some of our programs when you look at moving away from hand pump technology to more mechanized water systems that involve the private sector to play a critical role, including the communities in decision making. Over.
Thank you. Thank you. Great. There's a specific question for Salu. Salu, a question from Kristen on when should we expect results from your testing on compression, tension, and corrosion. And yeah, it's essentially a question. And when are you expecting to get your results from the testing?
When I'm going to the lab in September, hopefully after a couple of months, we should be able. I'll look at the next Stop the Rot webinar. I should really start putting in something preliminary. That's fine, but I should be able to share some of the findings. Just on Lucas, I think there was a question on low quality. I think when we're looking at low quality component, it has to be a holistic. We have to look at the life cycle, not just we're going to change it and it's cheaper for us or it's available. We also have to look at the effect it has on the community. If there are parts you have to change all the time, does that then make the availability of water to the community a bit difficult? Because if the hand pump is breaking all the time, that means the community is not going to get a source of water, clean source of water for a day or two. And how often can you look at that? So in cases, I might agree with you, but you have to look at the whole issue of the quality of the component in a holistic form, from inception to decommissioning. Does it serve the lifespan? Is it sustainable? Does it save cost? Or is it just because it's easily available? If you then have one component that serves 3-4 years, is it better than every 2 months you have technician coming in to replace a component? So you have to look at it holistically. That would be my answer to you, Lucas.
Thank you. Thank you, Salu. We have a question that links to O&M and sustainability for the World Vision team. It's a question from Santos. His question is, how can we ensure that after all the intervention, after the project life cycle has ended and we've handed over to communities, how are we able to make sure that communities are able to maintain the same culture of quality that is instilled within World Vision's way of working? And how do we ensure that communities are able to afford the cost of big repairs rather than minor repairs? So looking at the culture of purchasing supply chains in bulk ahead of time and thinking about life cycle costing and thinking about quality as not just the end, but the means to sustaining the infrastructure.
Thank you very much for that question. It is very interesting, particularly in the context of World Vision. As Dr. Fungai rightly said, we stay in the community for about 10 to 15 years. During that time, we have a system of building the capacity of communities, wash committees, artisans. We build their capacity when we take them to understand our movement toward the quality, so that at the end of the process, they are having skills, knowledge, but also the connection with our source of procurement, so that they will be able to procure there. At the same time, we are advocating at the national level, actually, to ensure that the government policies and principles, regulations are changing to ensure that we have quality material imported in the country. The third component is our work with our suppliers to ensure that the spare parts that are coming in the country, especially in World Vision operating area, are of good quality. So the combination of community awareness, their involvement in the process, their connection with the suppliers, and their understanding of quality issues make the difference. Thank you.
Great, thank you. Thank you, Sam. That was very useful response. Let's take a few more questions as we are approaching time. Let's, speakers, if you're able to address questions that may have been left out, I will rely on you to do that. But after you react to the final questions, I'll give each of you a moment to just share your last key message that you'd love participants to take home before we hand over to close the webinar.
Bethlehem, this is Frank. I will pick up on the a question around the timeliness of social behavior change cycle.
Brilliant.
And the infrastructure cycle. I mean, you can't change behavior as quick as you can drill a borehole. So take it from there. And clearly things are going to change. Thankfully, and Brian, you mentioned this on the call. We've got some great tools out there, haven't we, on behavioral change at Washam. And there are other sort of behavior change techniques that are applicable along the relief to development nexus, and that's great. But they all involve follow-on. So clearly, when I talked earlier about commissioning, a lot of SBC, social behavior change work, is going to be part of the follow-on, not just the handover, but the follow-on, people understanding. So another big question is CLTS. It maybe isn't difficult to eventually attain or be held to attain ODF in a community. What's difficult is maintaining ODF. And it really is to do with that follow-on and that connection. And this is where you ultimately come, Bethlehem, into Agenda for Change. It's the system, isn't it? Who's the backstop? Who have we involved? Who are the stakeholders? Not just what is the process, who's involved? And I think it's the who's involved and the the frontline capacity, where the community knows who they can refer to for the major repairs and how they refer to them. That's part of that system strengthening, and that's the direction. So I'm not saying Gap the Commission is a closed circle. You've done it, then you go to handover. Yes, there are particularly behavioral change components which will carry on, and following on is critical. We can't just go away, and we need to build a capacity of the duty bearers in particular, I think. Thanks.
Absolutely. Absolutely. Yeah. That interrelationship between the duty bearer and the right holder, very critical. Thank you, Frank. So on that same note, let me hand over to the speakers for their final remarks. And if each of the speakers can share their final remarks and key messages based on the questions they've heard so far. So let's start with Salu.
Yeah, I mean, just as I went through my presentation, water availability, affordable water is still a major problem in sub-Saharan Africa. And this is something we've gone through for the past 50, 60 years, so really looking to solve the problem one at a time. For me, from the quality side of things, I think if we can able to get some forensic evidence to support that, I think it's one less the problem. But we really have to make better. We have to make sure that we make improvement in ensuring that the rural community are able to get water all the time, and reduce the functionality of the hand pump. The non-functionality, of the hand pump. Yeah.
A fair point. Thank you. Shall we now hear from the World Vision team? Should we start with Samuel, Fungai, and finally Adam? For your closing remarks, final remarks.
Yeah, thank you very much. This is very exciting to have this discussion, and I have learned a lot. Let's say that the issue of quality is a teamwork. We are not seeing only one NGO doing this. We are not seeing only the government doing this, but it should involve both policy makers, decision makers, should involve the beneficiaries that are the community, should involve also those who are supporting them to achieve their goal. I mean, NGOs, funding organizations to understand the issue of cost and time consumption linked to the quality, seeking the quality. It requires as well for thinkers to start thinking about strategies, plan, processes to bring quality in, and also to ensure that once we have achieved the facility, it is up to the community to take over. That means they need to be involved from the planning stage, selecting the type of pump they want, selecting based on the availability of spare parts, their own knowledge, local capacities, and moving up to the post-construction work, including the operation and maintenance. So these are all the stakeholders involved in the process. And if we miss any of them in the process, including suppliers, obviously, if we miss anybody in the system, then our quality will have a gap. So I encourage everybody to work on that aspect. Thank you very much for this question and for this webinar.
Thank you so much,
Over.
Samuel. Over to you, Dr. Fungai.
Well, thank you very much. Just to build up on my colleague Samuel, just embracing the culture of quality means just making a commitment to excellency, particularly in all our processes, products, customer satisfaction. And then lastly, let's not look quality as just as a goal to achieve. It is a mindset that we should ingrain in our daily practices, fostering from the continuous improvement, innovation that we need to do. So it's a continuous process. So these are the key two words I just want to leave with our colleagues, that let's not keep it as a goal to achieve, but as a mindset. That's what we are trying to achieve as an organization, and all organizations can do the same. Thank you.
Important message. Quality as a mindset, quality as both as a means and an end. Key takeaway. Thank you, Dr. Fungai. Adam, over to you.
I think my colleagues and the other presenters really said it all. I'll just note that World Vision presented on our journey, but it's an ongoing journey. We have not arrived. And part of building this culture is recognizing that it's adaptive. We're always learning, always improving. And so I just look forward to hearing from you all. As Samuel mentioned, this is a collaborative approach. We can't do it alone, but thank you all for joining. Really appreciate this discussion.
Thank you so much. Thank you to all our brilliant speakers and presenters for coming in and sharing their experience, their lessons, their journeys. I think there were lots of insights and key takeaways for us to go home with. And with that, I'll now hand over to Sean. Sean, you have the floor.
Great, thank you. Well, thank you everyone for a fantastic webinar. There's been a huge amount of great stuff, but I just wanted to reflect on a couple of things that I've noted. I mean, for one of the goal of this webinar, what we wanted to do was to take the whole issue of hand pump corrosion, and which is a widespread problem, but can be seen as just quite a small technical detail that just needs to be fixed somehow. But I think what we've tried to do in this webinar is to bring in a bit of a zoomed out perspective, that actually the issue of the specific issue of hand pump corrosion is a symptom of a wider systematic challenge. And I think we could see how that is not just about hand pump corrosion. It's around quality. It's around how procurement is done. It's around governance. It's around a whole set of behaviours as well. But the presenters today, I think, have also offered hope, in that there is a way, by zooming out from the technical details of the specifics of hand pump corrosion, we can see that there is a way forward through all of us embracing a culture of quality, and how all of us take a leadership position. And also, as I noted from what Samuel just said, about teamwork. This is about teamwork. And I think by by really embedding these behaviors in our organizations, in our organizational cultures, we will address not just hand pump corrosion, but a whole set of other systematic challenges that we find in rural water supply, in WASH, and in international development. So I hope you've all enjoyed this webinar and this webinar series. I would really like to thank the speakers and panelists from today and across the whole series. And thank you very much to Bethlehem for facilitating today's webinar so well. I would also like to thank all the theme leaders, the RWSN theme leaders, and my colleagues in the Secretariat who've worked so hard behind the scenes to make this webinar and the whole series come together so well. I'd like to thank the Waterloo Foundation for supporting the Stop the Rot program and initiative, and which including this webinar. And for the more broadly across the series, I'd like to thank the Swiss government's contribution to SCAT Foundation to help us to be able to provide these kind of services to the community. And finally, just thanks to you, the audience. Thank you for your engagement, your fantastic questions, fantastic discussion, for your time. It's really appreciated that hundreds of you, literally hundreds of you every week are tuning in, you're listening, you're engaging, you're downloading the slides, you're watching the recordings, you're being part of the discussion. And I hope that all of us can just spread the word and help move everything that we're trying to do in rural water supply to the next level. So thank you all again, and I will leave it there.